Today we're going to talk about avoidance behavior and why this might be negatively impacting your rehab after a neurologic injury. You might recall a couple of weeks ago I did a video on learned non-use and how this creates or can contribute to what we call negative neuroplasticity. And what learned non-use is immediately after your stroke or your brain injury, you try to move your arm doesn't move, your brain remembers that, and it suppresses attempts of performing that movement in the future. So over time, it's a learned behavior that contributes to compensation. Compensation contributes to what I called that interhemispheric sprouting or contra-lesional sprouting, meaning you're getting neuroplastic changes on the uninjured side of the brain. Well, avoidance behavior is another kind of maladaptive behavior that, in my opinion, is at the top of the list of other reasons or potential reasons that people develop compensatory strategies that become hardwired. So today we're going to talk about what avoidance behavior is, why this happens, how to prevent it, and if you've already have some of these patterns hardwired, how to kind of break some of these what we call maladaptive behaviors and replace them with more kind of facilitatory behaviors that will promote positive neuroplasticity on the injured side of your brain. If you're new to this channel, I'm Tara, I'm a neurologic physical therapist, and on this channel we talk about anything and everything related to mobility, health, fitness, and mindset in the context of neurologic injury, with the end goal of empowering you with as many tools as possible to reach your highest maximum level. So with all that said, what exactly do I mean by avoidance behavior? Now keep in mind, I'm talking specifically about a learned behavior that occurs after damage to your brain or your spinal cord. And in that context, what I mean when I say avoidance behavior is any movement or task that you avoid or your brain suppresses because of an experience that causes physical or emotional discomfort. So where learned non-use, if you watched that video a couple of weeks ago, is when you try and move the limb early on in rehab and it doesn't move, your brain remembers that you had a failed attempt and it'll suppress future attempts at moving that arm. Avoidance behavior is a maladaptive behavior that is the result of when you attempt a task or a movement, that experience causes emotional or physical distress and it suppresses your brain's motivation or desire to attempt that movement or task in the future. Now that negative or unpleasant sensory or emotional experience can be associated with actual or potential injury. And as a result of that, it kind of focuses your brain or alerts your brain to protect that area where you had that negative emotional or sensory experience, and it creates a memory to avoid that experience in the future. Now, let's go through some of the factors which I think are the main contributing factors as to why someone would have an unpleasant sensory or emotional experience after a stroke or a brain injury. One is immobility. So you haven't moved your arm or your leg in a while. The soft tissue structures that are supposed to be pretty elastic around that joint stiffen up. You go to move it, you feel some resistance, and that might be an unpleasant experience. Where I see this primarily in the hip for anyone who has hemiplegia is usually flexing the hip or bringing the hip all the way up into flexion, or internally rotating it seems to be the two that create the most unpleasant experience after a stroke or a brain injury that results in hemiplegia. In the arm, overhead reaching seems to create that. External rotation or rotating the arm outward seems to create that, and extending the wrist seems to create that unpleasant experience. A brain lesion in an area of the brain that is involved in perceiving sensation can also contribute to certain movements or experiences being extremely unpleasant. Muscle imbalances or asymmetries can also cause this. So if you have weakness on one side of your body, you attempt to stand or walk, your hips are off, your shoulders are off, all of that asymmetry or those postural deviations can contribute to an unpleasant experience when you walk. Spasticity, which I talk about quite a bit on this channel, which is an involuntary muscle contraction, that can also contribute to an unpleasant experience when you try and move, primarily bending the knee or standing on the leg. If you have spasticity or involuntary pointing of the foot, that can be extremely unpleasant. Or spasticity in the wrist flexors or the elbow flexors. So when you go to extend the elbow or you go and try and extend the wrist, that can also be extremely unpleasant if you have an involuntary contraction trying to pull the arm in the opposite direction. And a poorly positioned joint. Primarily when this happens is what we call a subluxation, or when the shoulder or arm bone is partially dropped out of the socket. The shoulder is kind of like a cup and the arm bone is a ball that is supposed to sit inside that cup and glide really nice and smooth inside that cup. If that shoulder is subluxed or that arm bone has partially dropped out of that cup and you go to move it, it can also create an unpleasant experience because now you're not getting that nice glide, and when the arm goes up past a certain limit, usually about 90 degrees or past shoulder height, and some structures start to kind of bump into each other. I've done a lot of videos on proper mechanics of the shoulder, so that's not really the purpose of this video, but just know that's another reason why you might associate a shoulder movement with an unpleasant experience and develop a maladaptive avoidance behavior. And the other huge reason why you might develop an avoidance behavior is primarily for those of you that have a lesion on the right side of your brain. A lesion on the right side of the brain is associated with poor body awareness or poor perceptual awareness of where your body is in space. So you go to move your arm or your leg, and because you don't know exactly where it is, you might perceive that, these are words that I've heard, that it's being pulled out of the socket or someone's forcing it to go in a direction that it's not supposed to go. Sometimes that is not actually what's happening, but that is what your brain is perceiving. So if you in your brain think that something is being pulled out of the socket, or that something is being damaged because it's being pulled away from your body, that might also cause you to develop what we call like an avoidance behavior. Now, why is this so important? The more you avoid a behavior, the worse that unpleasantness is going to get over time. And also, the more, in my opinion, you're going to get that interhemispheric sprouting, which I talked about in that learned non-use video. Some people also refer to this as contra-lesional sprouting, which basically means you're getting neuroplastic changes on the uninjured side of the brain. So that is why this is such a huge topic and why I think it's so important to go over today. Now, I am going to talk about how you prevent some of this, and also kind of, if you already recognize that you're doing some of these things, how to kind of start unraveling that. But before I get to that, let's talk about some of the unpleasant emotional experiences that are associated with movements or tasks after a stroke or a brain injury. And some of those experiences are fear. So either because you don't know where your body is in space, and now you have maybe someone, a therapist, that you don't really trust kind of grabbing onto your arm and your leg, and you don't really have full sensation of that side of your body, that could be really scary. You don't really know what that person's doing. You just know that you feel something that feels foreign or uncomfortable, and that experience or that fear might cause you to avoid a similar movement or task in the future. Anxiety can also be associated with certain movements or tasks because either you're afraid of the unknown, you don't trust your body, or someone does move your wrist or your arm in a certain way and you feel a little physical discomfort, and because you don't really understand what that is, that can create a little bit of anxiety as well. Anger associated with a certain movement or task can also happen. Maybe someone bends your wrist or bends your hip up in a certain direction. You have an unpleasant sensory experience, and maybe this causes you to either get angry with yourself, angry with your situation, angry with the person that's actually helping you to stretch or mobilize in that moment. that can be an unpleasant experience that might cause you to maybe not want to do that same movement or task in the future. Sadness can also cause this, and also envy. Maybe your spouse is helping you move your arm or your leg, and you maybe feel that you don't deserve the situation that you're in, or that your spouse is moving around and can do whatever they want, and maybe that just makes you feel a little bit of envy. And envy is also kind of a negative emotion that can lead to maladaptive behaviors. And mind you, this is not black and white. This is just kind of all mixed in together, and all I'm hoping to do in this video is to just make you aware that this actually does happen, and that it is good to address these issues to make sure that you don't develop behaviors that are going to suppress your brain's ability to relearn normal movements or tasks. Along with some of those unpleasant emotions, there is a psychological component, and this is completely dependent on each individual person, past experiences, childhood experiences, experiences you had in the hospital. All of that contributes to some of the thoughts that you might be having, but some of the thoughts that people verbalize to me is that you're either catastrophizing, which basically means that you believe that a movement is going to be associated with injury or maybe even death. For example, maybe you were walking when you had your stroke, and so now you want to avoid walking because you believe that anytime you get up and walk, you're going to have a stroke and fall. That's just one example, but that's kind of an example of catastrophizing. Maybe you feel some kind of a unpleasant sensation in your body, and it leads you to believe that you don't have any control over your life. Or maybe you feel an unpleasant sensation in your body with a certain movement, and you think that you're always going to have this pain whenever you do that movement, and so you just stop doing that movement altogether. That's just a couple of examples, but there is a million things that you can come up with. My suggestion, and I strongly suggest this, I do it myself, I think it's extremely valuable, is just journaling and just trying to get out onto paper everything that you are thinking or feeling when your therapist maybe is helping you, when your spouse is maybe helping you. What exactly do you believe to be true in that moment? And that'll kind of help you to unravel some of this and hopefully prevent you from developing an avoidance behavior around movement, which is going to create or suppress that neuroplasticity that you're hoping for on that injured side of your brain. So how do you prevent this from happening in the first place? Well, we're going to go back to that list I went over at the beginning of all the very valid reasons why movement or a task might be associated with an unpleasant sensory or emotional experience. So let's start with the first one. Immobility. So if you have not moved your arm or your leg in a certain position, the ones I talked about were external rotation of the shoulder or internal rotation of the hip or full flexion. So bringing that knee all the way into your chest. Well, in that case, the best way to not make that experience so unpleasant in the future is to start moving that limb and kind of stretching those structures out, getting that elasticity back. So keep in mind that you're not damaging anything by moving it. The reason it hurts when you move it is just because it hasn't moved in a while. And the best way to make that experience in the future not be so unpleasant is to start moving it in kind of a graded manner. Start with a movement that is maybe a little bit uncomfortable but still tolerable, and then kind of work further and further into that range. So bringing that knee further and further in towards your chest, or moving that arm further and further out into external rotation. Again, maybe uncomfortable, but still tolerable. And same with the wrist. Start bending that wrist up. Now, there is one caveat to all of this. So for those of you that maybe before your stroke you considered yourself to have a really high pain tolerance and that you could really just push through things, remember there is a difference between having the motivation to push through something that you chose versus having to push through something that someone else is kind of forcing on you. So in those examples of moving that shoulder, that wrist into those positions, I would say that if someone else is doing it, maybe initially the better way to do it is for you to use your uninvolved arm and do that range of motion yourself. So that gives you a little bit more control. You get to choose and decide how far you push it, and that might be a good intermediate step. Now, on that same token, a lot of times you can't get into some of these positions, or you can't get that full range of motion back without help. And in that case, I would say just kind of be curious about that. Is it different when you do it versus someone else? And if so, is there a way for you to reframe that person that's helping you by either maybe you choosing the time of day that you do it, or maybe you're in control and you tell that person when to stop, putting you back in the driver's seat. That might be another way to help you, especially with the wrist and the shoulder. I find that those are the two where a lot of people really will start to just avoid those movements, especially because compensatory strategies are so easy with the other arm and kind of make life easier. But just kind of things to keep in mind. The other movement that is usually pretty unpleasant is reaching the arm back behind you. So that would be another one. The added factor in that one is that you can't see it. So you really do feel like that arm is being pulled out of the socket. In that case, I would say maybe bring a mirror in so that you can see it, and that might take away some of that fear or that anxiety, and it might allow your body to relax a little bit more so that you can go into that position, and also it might make the experience a little bit less unpleasant. Now, earlier I also mentioned that it could be due to the area of your brain that was damaged. Now, either an area of your brain was damaged that is involved in how your brain perceives sensation. That could be one reason why it feels extremely unpleasant, is just because your brain is getting a lot of alarm signals with specific movements. Or you have a lesion in an area of your brain where you don't have any awareness that that side of your body even exists. And so you feel your body moving, you feel like someone's tugging you around, and it just feels weird, but you don't really know that they're holding onto your arm. And in that case, I would just say, look at the area. A lot of times I see people close their eyes, or again, because of their stroke, they just kind of turn their head to the right. I would say, force yourself to watch the movement as that other person is helping you with that movement. As far as having a lesion in the area of the brain that perceives pain, a lot of times their medications do help temporarily, but the other thing that really helps is mirror therapy. I'm going to do a separate video on mirror therapy, but that has been proven to be effective, and also desensitization strategies. And I've also done a video on desensitization strategies. I will put a link for that in the description below. But basically, desensitization is just graded exposure to that movement. So similar to what I talked about in the first one, that you have pain because it hasn't moved in a while, so you want to kind of slowly reorient or reintroduce that movement to your body to make those tissues more elastic. Desensitization is graded exposure to that movement to desensitize that area of your brain so it doesn't send up an alarm signal every time you do that movement. So again, you want to start out with a small range of motion with the wrist and the shoulder and the hip, and just go further and further into that movement. But I will tell you, it is going to be unpleasant. That exposure is how you desensitize that area of your brain. So if you know you have a strong emotional reaction to an unpleasant sensory experience, which most of the time they go hand in hand, it is so valuable to also address the fear or the anxiety or the anger or the resentment or the envy towards the person that's trying their best to help you, really trying to unravel that aspect of it as well. And if you notice that those emotions come up with that movement or with that movement when a certain person is helping you with that movement, is there a way that you can reframe it? Or replace fear with facts. I mean, that's probably the most common. Fear and anxiety are probably the two most common negative or unpleasant emotional experiences associated with movement and tasks after a stroke or a brain injury. So I would say, look at it, replace fear with facts. That person that's helping me is not breaking anything, is not injuring anything, is not damaging anything. And then also another layer that I think is valuable is, can you zoom out and look at the bigger picture and what is your ultimate goal? And do you want to get that arm movement back, which I know many of you do, and kind of use that as motivation along with replacing the fear with facts that nothing is being damaged and that there is an end goal where that is not going to be so painful, and it is the route or the road to getting normal arm movement back. So now let's just talk about those asymmetries, those postural asymmetries. You have hemiplegia, you have weakness on one side of your body, and so you aren't standing perfectly straight. Maybe one hip is lower, maybe one shoulder is lower, and that can lead to, for in this example, walking being extremely unpleasant, or maybe standing with your center of gravity, your body in midline might be unpleasant because you do have some weakness on one side of your body. Best thing I could suggest in this case is take ownership of that, take some control of that, work a lot on standing, get a plan in place with some goals that you are going to work on standing and getting your body in midline so that the next time you get up and walk, it is more pleasant or less of an unpleasant experience. Spasticity, again, can make walking unpleasant, can make arm movement unpleasant, can make passive range of motion unpleasant, and then that can lead to, again, fear, anxiety, catastrophizing. I'm never going to get arm movement back, and that is just all going to contribute to you not wanting to perform those movements in the future, which is going to further suppress your brain's motivation to relearn those movements in the future. So a way to address that is stretch, stretch, stretch. Spasticity or involuntary movement causes adaptive shortening of the muscle, which means that over time it takes less and less movement to trigger a spasm. So stretch, stretch, stretch. Keep those muscles long. That is one way that you can take control of that situation and make arm and leg movement, standing, walking, arm movement overhead, a more pleasant experience in the future, while also keeping in mind, and I can't stress it enough, that there is going to be some discomfort with these movements, and the best way to decrease the amount of discomfort is to prepare your body by stretching things out. And then the other one I talked about earlier that can cause arm movement to be unpleasant is a subluxed shoulder. So I will say, in most cases, laying down repositions the shoulder closer to the midline of the socket, or approximates it in the joint better. So I would say if you just have like a little bit of a subluxation, when we talk about a subluxation, we usually measure it by fingers. So you'll see a little divot on the top of your shoulder. If it's less than a finger width divot, I would say in most cases when you lay down, it will kind of go back into the socket. So my suggestion would be to do all of your shoulder exercises right now lying down. I've stressed that in a lot of videos. I can't stress it enough. If you continue to make these experiences unpleasant, without even your consent, your brain is going to suppress doing these things in the future. So the goal is to move it, in this case with the subluxation, move it and making sure that the joint is approximated in the joint. Laying down is one position that you can do that. If you are sitting up, I would say keep shoulder movement below the shoulder. That might decrease the amount of discomfort that you have in the shoulder. And again, prevent avoidance behavior and developing negative neuroplasticity, or getting more interhemispheric sprouting or contra-lesional sprouting, meaning axonal sprouting or neuro rewiring on the hemisphere opposite to the side that has the lesion. So I hope there was something in this video that was helpful. Leave in the comments if any of this resonated with you, if none of it resonated with you, if you have just had no negative or unpleasant experiences at all since your stroke or your brain injury. That is amazing. But yeah, definitely leave your comments below. Share with the community kind of what your experience has been, maybe some strategies that have worked for you. You guys are amazing at helping each other. No one can help someone else better than someone who's going through the same exact experience. So keep those comments coming. They're absolutely amazing. If you're new to this channel and you haven't yet subscribed, go ahead and hit that subscribe button. Turn on that notification bell so that you'll get notified every time I upload new videos. I enjoyed spending time with you all today, and I will see you in the next video. Have a good day.